Hi, I'm Neely Thornton here at Thornton Dental Wellness. I am the owner and dentist, and I am excited to introduce myself to you, get you to know who I am and what my practice philosophy is, how I like to deliver dental care, and how I like to better you as a person. My history, who I am and where I came from. I grew up here in Georgia, in Rome, Georgia. I graduated from the Darlington School and went to Vanderbilt University for college. After college at Vanderbilt, I decided to take a little time off and live and enjoy the ski slopes out in Jackson Hole, Wyoming. There I worked as a dental assistant in a practice, learning a lot about the business of dentistry and ultimate delivery of patient care. I've always been passionate about people and relationships and also the healthcare. I knew I wanted to be in the healthcare industry in some form, but I wasn't quite sure why. So that gave me a little bit of opportunity to work in the field before I dove into a very consuming career path. I came back to Georgia for dental school and went to the Medical College of Georgia. And upon graduation, I moved into the Atlanta area. I worked for several practices in Cobb County for the past 4 years. And in 2009, I purchased a practice here in Marietta. We are located 1.3 miles west of the square on Whitlock Avenue. It's very convenient, easy to find, and it's a little tucked back, so you'll definitely want to give our ladies a call and get directions if you need before you come. Basically, the way that I see dentistry was only able to be performed by having my own practice. I've worked in several different office environments and each of them were wonderful, but being able to develop an environment and a culture within my doors was what my vision was. So this practice has been phenomenal for me to be able to truly reflect who I am and develop the philosophy and the type of patient care that I want for each of you as a patient. So you'll find that when you come into the practice, you'll be welcomed with open arms, smiling faces, and a comfortable, relaxed environment. The way that we see dentistry is it starts with understanding of what is going on with you, with your whole body, as well as with your smile. So if you think about the oral systemic approach and the oral systemic link, it's encouraging to know that we can help you to understand a little bit more about what's truly going on with you as an individual. Upon your first visit, you will get a lot of information, but we'll also listen to your desires and what you came in for and try to help you to achieve those desires and those needs. I like to listen to the patients, as I said. I like to think of myself as a dental advisor. I gather all the information, I do my diagnostics, and together we do a co-discovery process for understanding where we want to go on the path to a healthier you. So in saying that, I encourage you to come in and let me help look at your overall self and help to encourage some better approaches to take better care of yourself. So anyway, let's see. Technology-wise, we do use a lot of advanced technology in the office. We find that it's easier and more convenient, more efficient to use digital radiographs, to use cameras and photography. I use a lot of photography in my diagnosis. It's really easy for me to diagnose looking at this black and white screen, but for my patients, it's nice to see the colors and the natural photos and stuff. So we use a lot of before and afters. We use a lot of your own teeth and your own current situation so that you can understand where you are and where you want to go and where you may be inspired to go by just a simple understanding of the future possibility driven theory that I have. So let's see, the services that I provide range from just basic preventative care, your basic cleanings as we call them, to advanced procedures such as Invisalign, full mouth restorations, cosmetics, veneers, as well as anything that you would like to do we can accomplish here. I go to advanced continuing education courses yearly. As a dentist, we are required to have 20 to 30 CE credits every 2 years, and I probably accomplished at least 4 times that. So I'm spending a lot of time outside of my practice reinvesting back into how to be a better clinician and a better diagnostician for you. I take advanced courses in cosmetics and in treatment planning, in the temporomandibular joint, and disorders that are associated with occlusion, which is the way that your teeth come together, your bite. I like to see myself as a physician of the masticatory system. That means is how well your system, your chewing system is working for you. So not only just the aesthetic aspect of it, your smile, your health, but also the way that it functions. So we do a lot of things to help encourage you to be a healthier person. What you can expect when you come to our office as a new patient is that we get to know you, we get to know who you are as a person and as an individual, and then we help you to understand what your current state of health is and where you can go to improve any little aspect of that current state, starting with your smile and everything else, so all that good stuff. So thank you for your time. I really look forward to the opportunity to serve you and to be your dental care advisor. I have a wonderful team of exceptional ladies that help to make this easy for you as well. On top of all the fun things that we do, the things we see as fun, we also provide oral sedation and nitrous oxide laughing gas to help make it easy for you to relax while you're here, in case it's hard for you on the inside to settle those nerves down. So come in and see what we have to offer, and we look forward to being the next dental care provider for you and your family.